This is Dr. Mubin Sayed from drbean.com. Welcome to one more show. The discussion today that I want to do is about an in vitro study of heparan sulfate, which the researchers have found may be also responsible for helping the SARS-CoV-2 to enter our cell and infect it. So based on that study, they also then hypothesized that if we can give an enzyme that can block the heparan sulfate, then the viral entry into the cell can be reduced. Similarly, those folks who are on anticoagulants, especially with heparin, which is mostly inside the hospitals, low molecular weight heparin is given in some of the patients, for example, heart attack or other patients, stroke patients or pulmonary embolism or other coagulopathies. So those patients are actually, according to this study, protected from entry of the SARS-CoV-2. So let us talk about that and look at what that study is and what is the mechanism of action. I hope everybody is safe and sound, and let's start our discussion. Cool. So here is the study. So COVID-19 virus uses heparan sulfate to get inside a cell. So here, this is the study. I'm going to go over this in our own drawings. This is, if you wanted to read more about heparan sulfate, this is that. This is the heparin, not heparan sulfate, but they are similar molecules. So this is low molecular weight heparin that we use in hospitals, as I said, for anticoagulation. This is also the drug information for heparin. This is also for heparin. And finally, this is the mechanism of action of heparin. And this is the American Heart Association. So with this, let's start. Here is what they found. What they found was, if you focus here in this area, we know that this is the ACE2 enzyme or ACE2 receptor for the SARS-CoV-2. This is a SARS-CoV-2 virus. The virus connects with the ACE2 enzyme. We also know that it needs TMPRSS2, which will then prime the spike protein and allow the spike protein to be split into two parts. One part will fuse with the cell membrane and the other part connects with the ACE2 enzyme. The researchers found that there is an additional molecule that is heparan sulfate. Heparan sulfate is, as the name says, it is a heavily sulfated glycoprotein that is present on the surface of many of our cells. So here, this is this molecule present, and researchers found that a part of this molecule, heparan sulfate, has to bind with the spike protein at the receptor binding domain, and that binding will allow the receptor binding domain to open up and connect with ACE2 enzyme. And what they found was that if this connection, if this binding does not happen, then the spike2 protein finds it difficult to connect with ACE2 enzyme. And in vitro, they found that there was 80 to 90% reduction in virus's entry into the cell when heparan sulfate was blocked. So now if you see here, we can see multiple drugs that can actually work to reduce the viral entry. Remember TMPRSS2, so that will be camostat mesylate and the bromhexine. Then for the ACE2 directly connection, so that may be angiotensin receptor blockers. And then over here, this is the new set of drugs that may be useful. It still need to be done studies in vivo, that means in our body, but in vitro, there is a new set of drugs, and that is heparin. So that may be useful. So now let's look at the conclusion that they had in the study. So what they found was that 80 to 90% reduction occurred in vitro. So these are some cells that are present in this dish, and these cells were treated with two types of drugs. One were enzymes. So if you see here, this little scissor, enzyme that could block heparan sulfate or remove heparan sulfate from the cell surface. When the researchers introduced this enzyme and removed the heparan sulfate from the cell surfaces, they found that the viral entry reduced by 80 to 90%. Now, in practice, in our hospitals, we use heparin for anticoagulation. Heparin is a very negatively charged large molecule. It cannot be taken from oral route. It doesn't get absorbed from the GIT very well. So it is actually given intravenous or sometimes subcutaneous, mostly intravenous. Even intramuscular injection is not given because it can actually cause bleeding where it is given. It is an anticoagulant and can cause hematomas to be produced inside the muscles. So most of the time it is given through the diluted IV. And what they found was that if we give heparin, again in vitro, heparin would actually bind with the spike protein, and that would then block the virus from entering the cell. This heparin would act as a bait, if you will. And the virus will think that this is the heparan sulfate on a cell, and it would just bind with the heparin. And now the virus cannot actually enter the cell because it is now covered with heparin and it cannot bind with the cell. So there is a question that, is this blood thinner? Yes, it is a blood thinner, heparin sulfate. Now here are a couple of interesting things. And I see there is one more question from James. Isn't heparin used in Math Plus as well? Absolutely, as an anticoagulant. So over there, the usage is for anticoagulation. Here, the researchers found that the usage of heparin is as an antiviral. So that means if, God forbid, I am sick and I'm taking heparin as an anticoagulant, I might be protected from SARS-CoV-2 for the viral entry. So James, look, the heparin is used as an anticoagulant in the inflammatory and hypercoagulable state, agreed. This is an early stage where the virus needs to enter the cell, and over there heparin can be useful. And here is a very interesting thing. I love this one point. If from this whole discussion, if you can just take this one point, I think we are good. And that is, number one, heparin worked as an antiviral in therapeutic doses that we give to the patients. So the higher doses do not need to be given, number one. Number two, and this is the most beautiful part. In the heparin, if I can show a little bit how heparin works. So what happens is that heparin has a structure like this. So in this structure, this is called a penta. Penta means 5, pentasaccharide. Saccharide simply means carbs. So it has two kind of parts. One part is this pentasaccharide. The pentasaccharide part is important because it connects with antithrombin. Antithrombin is a molecule, and I'll show that in a second. It is a molecule which will, of course, neutralize thrombin, and thrombin is necessary for blood clotting. So when this part of heparin, this pentasaccharide, binds with antithrombin, then what happens is this heparin molecule kind of wraps around this. So this tail changes. This is called a conformation change. It wraps around this and kind of becomes like this. Then what happens is other clotting factors, for example, thrombin and factor 10A, they come and connect here and they are deactivated by this antithrombin. So basically what we say is that heparin potentiates, accelerates, increases the function of antithrombin, which in turn is an anticoagulant. And I'll show that in a second. What I want to tell here is our concern with using heparin will be what? It is going to cause bleeding. So let's say if I am healthy and you give me heparin as an antiviral, then you are going to expose me to possibility of thin blood, which might cause bleeding. what the researchers found was that even if you remove this pentasaccharide from heparin, and this pentasaccharide is necessary for anticoagulant function of heparin, if you remove this, that means the anticoagulant function is gone. Even then, the remaining heparin can work as an antiviral. That is what I love. That means we can have a modified molecule of heparin which does not act as an anticoagulant. So the risk of bleeding is not increased in people, but it would act as an antiviral. I love that part. It's just beautiful. So back here, it works even when the anticoagulant zone of heparin is removed. So these are the two important things. So now let's look at this mechanism of action, which I just described. So over here, I'm just going to tie this together. So we know, and I have done this discussion in detail in hypercoagulability lectures. So there are two of them. So if you wanted to see the whole detail of clotting system, you can go and watch those. Here, I would just say this, that our clotting mechanisms, there are two types, intrinsic pathway and extrinsic pathway. Both of the pathways, when they become activated, they finally reach a point where they activate factor 10 of the clotting factors. This is called the final common pathway. That means both of them converge here. Once they converge on factor 10, the factor 10 will then cause the prothrombin to become activated to thrombin, and thrombin will then activate fibrinogen to fibrin, or it actually cleaves, it cuts the fibrinogen into fibrin or active form, and fibrin will then cause clotting. So this whole area is the final common pathway. So if with some mechanism, if we can block factor 10, then we will block clotting through both pathways, correct? And here is what happens. This is heparin, and let's call it low molecular weight heparin, or LMWH. Low molecular weight heparin has a longer half-life. For example, I think it is 4 or 5 hours, compared to high molecular weight heparin, which has a shorter half-life. And it is easier to deliver it once to a person, and then it stays effective for 4 or 5 hours, instead of delivering this drug every hour or every half an hour. So this is why LMWH is used compared to heparin. Now, let's say this is the molecule of heparin. What it does is it converts, it binds with antithrombin 3, and then antithrombin 3 will complex with thrombin and active factor 10, and it would inactivate them. It can inactivate factor 10, that would block this path. It can also inactivate thrombin, that is this guy, and then block this path. Essentially, in both cases, it will block the clotting. That is the function. So now, as I said before, this part, look at this part, this purplish part, this pentasaccharide is necessary for the heparin to act as a blood thinner, and we can remove this, and the remaining molecule of heparin would still act as an antiviral for SARS-CoV-2. Now, just for some completion's sake, why do we use low molecular weight heparin? Because it has a longer half-life. Administration is usually most commonly IV, and then sometimes subcutaneous as well. Adverse effects. So of course it is a blood thinner. So adverse effects are going to be all related to coagulation. So if you see here, adverse effect bleedings. And if bleeding does occur, the antidote for bleeding, or the antidote to remove heparin, is called protamine sulfate. Thrombocytopenia, or heparin-induced thrombocytopenia. Thrombocytopenia means reduced number of platelets. Osteoporosis, rarely. Osteoporosis, that is weaker bones. Then spontaneous fractures, again, rarely as a result of the osteoporosis. Hypoaldosteronism, hypersensitivity reaction, and liver disease, and some more. In this, the most common are bleeding, and then sometimes thrombocytopenia, and sometimes hypersensitivity reaction. The other ones, osteoporosis, fractures, hypoaldosteronism, and liver disease, they are less common. Contraindication, when to not give it. Again, this is not a complete description of heparin, and please do not use heparin without prescription. And heparin is only used, should only be used in the hospitals under a doctor's supervision, especially in emergency situations. It is not a day-to-day drug to take it at home, so please do not use it as a drug. It can actually cause severe blood thinning, causing strokes and heart failures and bleedings and so on. Contraindication, if somebody has a trauma where they're already bleeding, giving a blood thinner would actually increase their bleeding. Hemorrhagic disorders, folks who already have bleeding disorders, if you give blood thinners on top of that, they would have further issue. Peptic ulcer disease, the ulcer in stomach. And once again, why do we not give heparin in that case? Because the ulcer would start bleeding. Recent cerebral, excuse me, recent cerebral hemorrhage, and you may have noticed that my cough has become much better. The air quality has become really good. I think we had some rain. So recent cerebral hemorrhage, severe hypertension. Again, why in severe hypertension? If somebody is severely hypertensive, on top of that you give blood thinner, that thin blood is going to create Bernoulli's, or blood flow would change, and that flow can actually cause blood vessels to start bursting, and that would cause strokes and other such things. So severe hypertension, we don't give it. Recent eye or nervous system surgery, epidural half-life, menstruation. So of course, if somebody is menstruating and they are bleeding in a sense, and then if we give heparin on top of that, that can increase the flow. Liver disease, severe thrombocytopenia. So if somebody already has thrombocytopenia, then we do not give heparin on top of that, because that would cause further bleeding disorders. So this is the discussion. Takeaway for us is what? Number one, people who are taking heparin, they may already be better protected from SARS-CoV-2 in the viral entry phase. Number one. Number two, heparin may be useful as an antiviral even after removing its anticoagulant part. So without its anticoagulation factor, it can still act as an antiviral. So this is the discussion. I'm just going to go over this very quickly. This is an in vitro study. So of course, this means that it needs to be looked at in vivo or in other ways to experiment, but this is what it is. So if you see here, this is the last part, and then we stop. University of California, San Diego School of Medicine researchers. So San Diego is about 6 hours from my place by drive. I love San Diego though. Discovered that SARS-CoV-2 cannot grab onto ACE2 without a carbohydrate called heparan sulfate, which is also found on lung cell surfaces and acts as a co-receptor for viral entry. So that is their basic understanding that they found. And they found that what we can do is, how can we use this understanding in SARS-CoV-2 time, this pandemic? Number one, we can give enzymes that would remove heparan sulfate from the cell surfaces, or we can give heparin, and this would reduce the viral entry by 80 to 90%. So that is this here. And then they talked about, this part was really interesting. I really am kind of enjoying it. Likewise, treatment with heparin also blocked infection. The heparin treatment worked as an antiviral at doses currently given to patients, even when the researchers removed the anticoagulant region of the protein, the part responsible for preventing blood clots. So then they say that we should do some more research. So this is the discussion for today. Tomorrow we have an open forum, so I'm going to be answering the questions that have been given to me, and we will go from there. Please stay safe and happy and healthy, and I would see you tomorrow. Thank you very much for joining me today.